the healthcare sector, I mean, there are a lot of different, subsectors within healthcare. And our work has, probably transcended across all the different subsectors at one stage or another. We've worked on transactions in the device space. We've worked on transactions in the pharmaceutical space. We've been involved in a number of transactions where you've got a roll-up of different types of clinics or operations. That seems to be an ongoing theme in the healthcare space. There's a lot of capital that is interested in pursuing roll-ups, and whether that's dentistry or fertility clinics or pharmacies, that's another area where we've been quite active, and we've raised capital. We've done M&A transactions in those types of environments. Another big part of the practice has been in long-term care, seniors' homes. Again, we've been very active in that space as well, and that component of this space is hard to execute on because you need real estate capability. You need to understand the healthcare environment. You need to understand the policy environment. You need to understand how different investors look at those segments, because different parts of them have different valuation aspects, right? Things that have more of a real estate angle, will tend to trade on a cap rate basis at a much higher multiple than something that's got operating risk and funding risk and things like that. So healthcare very much plays to our strengths, because we are a firm that embraces challenge and embraces complexity, and the healthcare file has all of those things, and and we've been active in it to the point where we can address very real and very new challenges. One of the big things that we're seeing in healthcare transactions now is, how is AI going to affect these businesses? How are doctors going to deal with their patients, and are there AI tools that are either going to disrupt that business model or grow it? And so there are a lot of different ways that I could see healthcare going, and I think the background that we have and the fact that we've done a bunch of deals in the space, I think is going to be able to help clients navigate these challenges. I think the other thing too that is really important with healthcare is it is a global business, and we've been able to work very closely with our different IMAP partners in executing on healthcare deals. So we've done a lot of work with our IMAP partners in Europe, accessing different types of strategic and financial buyers there. Helping our North American clients, look at expanding their business outside of Canada, because there are a lot of Canadian companies that are in the healthcare business, but actually where most of their business is either in the US or Europe, just because of the nature of the Canadian healthcare system. And so having an international capability, being able to identify acquisition targets, being able to identify merger partners, investors outside of the Canadian border, is actually really, really critical, and we've had a lot of success doing that.